Hi everyone, in this video we're going to review the pediatric healthcare provider cardiac arrest algorithm for one rescuer, so the latest information on pediatric cardiac arrest. Now it all starts with, is the scene safe? Which is getting harder to do out in the field, so be careful, be aware, be safe. Next, establish unresponsiveness. Poke this kid with a stick, a little sternal rub, and see if they're unresponsive. Now, if your victim is unresponsive, your next step is to get help. Like many of you watching this, I've had hundreds of cardiac arrests. I never did a single one of them alone. Simplest thing to do, pick up your cell phone, dial 911, put it on speaker. You can lay it right next to the victim's head. You can start chest compressions and talk to the dispatcher at the same time. But we can start the resuscitation and get help coming. Once you know help is coming, you're going to assess for a pulse and breathing at the same time for no more than 10 seconds. So check a pulse, you're looking at the chest. And I want to talk about gasping respirations because these can be confusing. This is taken from a very popular YouTube video, and it clearly demonstrates gasping respirations. You can see the mouth move, the tongue's kind of popping out a little bit. Looks like he's trying to breathe. He's not trying to breathe, he's trying to actually die in this video. But that is what gasping respirations look like, and they can often be confused with actual respirations. So what you're looking for is chest rise, rhythmic chest rise, chest coming up and down. This does not produce rhythmic chest rise. Now, if your patient has a pulse and they're breathing, they're just unresponsive, the algorithm says to continue to monitor them and wait for help to come. Try to figure out why they're like this. Are they a diabetic, maybe? Try to get some other history on them. Do they have seizure disorder, and what we're seeing is a seizure? So try to get some more information about this patient as to why they're unresponsive. Okay, so let's say through your assessment you find your patient has a pulse, they're just not breathing very well. When do you see this in America? Yeah, overdoses. So, we're gonna have to breathe for them. They'll administer one breath every 3 to 5 seconds. Every couple of minutes, go back and reassess. Make sure they're maintaining that pulse. But if they're just not breathing, one, suspect, is this an overdose? Treat for that. Then administer one breath every 3 to 5 seconds to a rate of about 12-20 minutes. Now at this point we're asking, was this a witnessed arrest? Did someone see this child go down? Because it makes a difference what we're going to do next. If you saw the kid go down, right there they want you to activate EMS and go for an AED, because we saw him go down. We got some time, it just happened. As opposed to finding the kid down. Then they're recommending a couple of minutes of CPR first, good compressions, ventilations, then go get help. Because we don't know how long the kid's been down for. So we want to do a couple minutes of CPR first. Okay, so the compression to ventilation ratio for one rescuer is 30-2. Now, if a second rescuer shows up and they know CPR, please change to a 15-2 ratio. By doing that, we're giving twice as many breaths to this kid, and that kid needs breaths. Kids need oxygen. That's why most kids arrest in the first place was a respiratory issue. So moving to a 15-2 ratio gives the kid twice as many breaths. Do that. Please. Now, as soon as the AED arrives, attach it to the patient and let's see if they're in a shockable rhythm. If they are in a shockable rhythm, administer the shock. And immediately after the shock, resume chest compressions for another 2 minutes, then reassess the patient. Now, if we find that no shock is advised, continue chest compressions, 15-2 ratio if you have 2 rescuers, and wait for help to arrive. Okay, so this has been a review of the BLS Healthcare Provider Pediatric Cardiac Arrest. I'm Mark. Thanks for watching. We'll see you in the next video.